Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this episode of the Exam Room's CAHPS series, Dr. Rhiannon Winsor is back with Kimberly Gonzalez and Sam Reinhard to explore the game-changing impact of proactive strategies. From digital signage and team-based messaging to asking one simple question, "How are you?" This conversation reveals how small, intentional actions before and after the clinical visit can transform the patient experience. Whether you're a care team member, front desk staff, or clinic leader, this episode delivers actionable low-cost strategies that drive CAHPS results and deepen patient trust. If you're ready to improve your scores and your culture, it starts here.
Okay, so we are back in the exam room with Kimberly Gonzalez and Sam Reinhard, and we're continuing our discussion about the CAHPS survey. And in this episode, we're focusing on proactive strategies for improving the CAHPS results. What would you ladies say is one proactive strategy FQHCs can implement now to start improving CAHPS performance, especially in high impact areas like communication, which we've talked about a little bit in previous episodes, about test results or maybe after hour care?
For us, at least, it's sending patient reminders, putting it in places where they're commonly looking, setting those expectations, whether they're verbal or nonverbal, letting them know. We use like the digital screens in our lobby to sometimes provide these education. So the more times you see it, the more you'll recognize it. I think the difficulty in call us after hours is when something comes up after hours, you're a little bit more panicked. And so it's very difficult to remember that. So the more you're saying it, like, hey, if anything comes up, give us a call. I'm on call, or whatever the case may be. You have to keep those nuggets in different places, tell them in different ways, but continually push that message to those patients. Same with lab results or imaging results, those kind of things. Set those expectations, let them know you're probably actually going to see those before I do, because that's truly what happens. Patients get the messages saying that their labs are in, but they get those. Sometimes they hit their system before they even hit the provider's system. And so mitigating some of the frustration, because what generally happens is the patient then tries to call and the provider hasn't even had a chance to see it yet. But so letting them know that that's going to happen, I'm like, the systems work really quickly. And honestly, you'll get them probably from the lab ahead of time. And then we'll get a chance to review and I'll make comments if there's anything you need to know or if I need to see you. And so setting that up for that patient. When we have nuggets like that, we'll try to put it in writing, like on the digital screen so that patients can see it. Sometimes we'll make like little printouts so they have an idea that they'll get from the lab. And then the providers can also cover that message. So hitting it multiple ways and multiple times is very important.
More communication channels, the better. And I like what you said about putting those things where the patient actually is, where they're looking, kind of meeting them where they are, kind of thing.
Yep.
Yeah, like that.
Yeah, I think without adding too much, because I fully agree with everything you said, it's just clearly communicating and setting the expectations. That'll help reduce the patient's anxiety and overall just improve their overall experience. And then just letting them know what options are available to them. Mm-hmm. A lot of the time, like we've said multiple times before, the patients don't know what they don't know. And the only ones who fully are aware of what they have available is a lot of the times the front office staff, the MAs, the providers. And so sometimes it's just offering more than what's asked of you, and that'll in turn allow the patient to know what they have at their disposal, and that truly makes them feel heard and seen. And I think a lot of what we can do proactively to make sure that we're in turn improving their experience, but also working towards improving our scores, which is the end goal of this.
Yeah. Absolutely. And I think we've talked about this in some previous episodes. So for our listeners, if you haven't listened to those, go back and listen to our other episodes on the CAHPS survey. But, really creating that team approach from, your front office staff to the provider and kind of everything in between. How can we leverage that to create a more CAHPS-friendly patient experience?
really making sure that we set the expectation that there's a team behind your care. And so the more we say when we call patients, "Hi, I'm Sam. I'm part of your care team. I was reviewing some labs that came in and we had a question," or whatever the case may be, right?
Right.
But the more we push that language, the more cohesive it looks to the patient, but also it lets them know there's a team behind them. And so then when we go to make these improvements, there's probably a lot more than the people they even see face to face making a lot of this happen for them, right? Even down to like HIMSS department pulling your hospital records and trying to get these out external documents so that provider can be really in the know whenever you do come in. So whenever we try to say, "Hey, as part of your care team, we're just trying to collect all of the information so that whenever you do see the provider, they can really see the full picture of what's happening with your healthcare." A lot of that comes down to conversation, but it's also shifting it to let them know that there are people that help your provider. And so there's a whole slew of people working to help you achieve a healthier life.
And it's important that everyone in that pipeline recognizes that they are in turn contributing to that patient experience, because they have to see themselves in it. I know a lot of the times, especially on the eyes of the patient, it's just the provider, but there's a whole team behind them. And that whole team needs to realize that they are the ones carrying the message of we care beyond the walls, beyond the four walls of our clinic. And they need to reinforce that by communicating, setting the expectations, and especially when there's handoffs. When there's handoffs and there's different personnel engaged, that sometimes can lose the trust. And so you need to make sure that everyone has that in mind, that whenever you're reaching out to the patient, listen carefully, offer what you can, over communicate. Sometimes it's better to over than under communicate, right? And ensure that always at the forefront of everything you're expressing empathy and that you're reinforcing that idea of we care. And so let us be there for you any way we can.
Yeah, I think we just keep coming back to communication, right? Like just ramping up the communication amongst staff and with the patient. Having said that, and communication might be the answer to this, but what would you say is your favorite low-cost, high-impact strategy for improving patient experience?
I really do think that most of it exists outside of the exam room and the extra things you do whenever you make those extra phone calls, because you're not generally calling for something urgent. Maybe it's just because we want to try to schedule you in for something, but you have a lot of opportunity to show a patient you care, right? And really just say, how are you doing? Because you're not really part of this production line of a healthcare visit, right? Where it's not like check in, get to the brew. Like it feels like you're moving along an assembly line a little bit. But whenever you do these extra things that we work really hard on from like this MSSP perspective and this case management and care management and these models, a lot of the opportunity exists in there to really show a patient you care, and really making sure you know that you have that opportunity is valuable, and to explain all of what's happening to them so that they see that value. I do this customer service training and I have this presentation and it shows how many touch points you have with the patient. And some of them are actual verbal touch points and then some of them are not. I throw myself under the bus. If my website is not communicating the right tale, I'm already setting us up for failure. So I think whenever we look at these little nuggets, we have to remember that the touch points are not always verbal. Where do disconnects lie? And a lot of times there's such small little easy tweaks because maybe the signage in the clinic is wrong. I'm like, there could be a lot of these different pieces that patients are using as visual cues. And how can we look at some of those little pieces that still contribute to the expectation and the perceptions of the patient? I try to teach people we're all a part of it. We're all a part of the patient outcome, whether we get to see them physically or not. And so remember, we're all a touch point. Sometimes we're more than others, but all the way down to someone who will never see someone in the exam room, our website matters. The way you smile on the phone while you're talking matters.
Yep. Very low cost strategy.
And they're very low cost. Correct. All you have to do is say, how are you today? And so I think that those things are very easily overlooked, but they shouldn't be.
Sadly, like from my experience outside of like having surgery, I don't think I've ever had anyone call from a health center to just ask me, how are you? How did the visit go? Do you have any questions? Never. in all my years.
I think that that's a time thing, and most people don't think it matters. They think you're going to tell them if it didn't go well. And I think it's waiting for them to come to you versus going to them. And so it's a shift, but I think you're going to see healthcare get there because people are perfectly fine going about their business.
And I think that's the shift that we're seeing nowadays is before we used to be very reactive and it was wait till you hear it. And in that, you sometimes can wait months. And by that time, you've already tainted the experience so badly where this patient might not ever want to return back. And so that proactiveness where you're actually out there reaching. And one thing, like Sam was saying earlier, is you have to put yourself in the shoes of your patient. Go through the journey that they would. Where can things possibly go wrong, or where could we fall short, and how do we kind of proactively work towards preventing that? And sometimes it's like Sam said, having information on the website that you would normally say to the person or have it displayed in your waiting room, have that available on the website so it's a reinforcer. Have it as handouts available on your patient portal that the patient can download at any time, and letting them know that they have all these options available. Again, teaching them what you have at your disposal and empowering them to be able to do it themselves, or ask those questions if anything was still unclear. But that's the key part, is you have to be willing to put yourself in their shoes and try and act ahead of time.
As I stepped into teaching, I had all of this education before I became a teacher. And so I didn't really know how to be a teacher. But the one thing that I kind of pulled from in the beginning was, well, I've been a student for a lot of years and I know what felt good and I know what didn't feel good and I know what worked and what didn't work. And I started to apply those things in my practice. It's interesting to me because we're all patients at one time or another, even if we are healthcare professionals. Sometimes maybe we're kind of jaded because we've just been in it and around it and it makes sense to us. And just to always remember, to our patients, it is difficult to navigate that system, just like you guys said. And as much as we can bring them along, the better.
And I think that's one thing that we've had to coach our beneficiary engagement center really on doing is, okay, put yourself in their shoes. If you're getting a call out of nowhere from a number you don't recognize and you're already very spam, fearful, and you have all these ideas going around in your head, what would make you want to have that conversation? And like Sam said, sometimes it's as simple as asking, how are you? How's your day going? Oh, I hear a dog in the backyard. Is that your puppy? Be willing to take those conversations outside of what's within your role or your scope, and really opening that reminder that we're all human. I just want to build that connection, establish that relationship, because long term, that's what's going to matter. And that's what's really going to make the patient feel heard and cared about. But it's really important that you think about that, which is we're all patients. We've all been there. We all know what we would like to see. So let's try including that in our day-to-day activities.
Any other thoughts about proactive strategies?
Sometimes it's the mentality also of just staff. Sometimes they sit behind a screen and they don't necessarily have that patient interaction. And so they might not necessarily think I matter or I make a difference, but everyone does. And ultimately, regardless of what you're doing, at the end of the day, you have to think about the mission and what's the purpose why we do this. Yes, there's financial incentives to improving this, but that's not our end goal and why we do what we do. We want to make sure that we're improving the health outcomes for the patient and improving their experience. And that comes down to every single player at the clinic. And so that's one thing that you need to reinforce, is that we're all there to support the patient experience, and we're all backing the provider and the MAs and the frontline. Everyone works together.
I think you have to remember about patient experience. As much as I think you could talk to some very clinical people and they're like, it's about diagnosis and getting them well. Well, if they don't have a positive patient experience, they might not seek your care. And the whole goal is to seek the preventative side and to reduce hospitalizations. The goal in primary care is to have them see you. You can keep them well enough to keep them out of what I call the big house, obviously, right? Because we don't really talk about jail. But the goal is to see you early. We don't want to see you once something's so far gone, you've created all this damage. If you don't create that positive experience, they're not going to seek you in the first place. And they're going to do exactly what I just described. They're going to wait so long. Their only option is the big house. Right? And then we're going to see them after and we're chasing it. And that's unfortunate because that's not the goal. And so if you don't hone in on patient experience, then you're really being counterintuitive to the goal in the first place.
And with that, the multiple touch points you have, they're all opportunities to educate and empower the patient, because ultimately you want to make sure that they feel in control of their healthcare journey and that you're just there as an assistive tool. And there's a lot of things that we can do to educate them. And ultimately, it's even if it's small things like promos that we've done, where it's like, how do you know when to pick PCP, ER, urgent care? Something that we as healthcare workers know and have at the front of our mind, but the patient doesn't necessarily have that. And so it's that education portion, and again, putting yourself in their shoes and thinking, what would be useful if I were in their shoes, and how can I prevent certain things from happening, and reinforcing that primary care message.
Absolutely. Well said. Thank you so much for providing those tips.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.